Hi everybody, this is Michelle from Virtual Hand Care, and in this video I'm going to show you 5 of my best treatments for your thumb after a thumb fracture. So if you are experiencing thumb stiffness, maybe loss of mobility, maybe loss of thumb strength too when you're pinching or gripping things because you had a broken thumb, maybe your thumb was in a cast for a while, or you had a sprain, strain, you had surgery, whatever the case may be, then these exercises are for you. Do make sure that you are completely healed and that you do get clearance from your doctor before you start this program or any kind of exercise program. So let's get started. Okay, so tip number 1 is to use heat. I really like using heat, and there's many different ways that you can use heat. You can use rice. You can put rice in a bowl, and you can just dry rice, and you can put it in the microwave for like 60 to 90 seconds. You can put rice in a sock. You can also, if you're crafty, you can put rice in and make your own little hot pack like I've made myself here. You can get hot packs online, and I do have a couple of favorites that I'll link below as well. But I really like this one from Sunnybay. It's an extra large hot pack and cold pack, so that's wonderful for that thumb stiffness. But I like it because it's big enough to conform around the whole entire hand and thumb, and it's even big enough to sneak that other hand and thumb in there too. You can also just use some warm water. Put some warm water in a sink or a bowl and just do some light movement in that warm water. That's a great way to start loosening the joint up before you go into some of these exercises. Now, tip number 2 is what's called thumb IP exercises. It's very, very important to start moving the little joint of the thumb first in different planes of motion before you just all of a sudden try to go move. So to do this, what you want to do is you want to block right below the thumb crease, and you want to start with your thumb all the way out into as much extension as possible. So if you have limited extension, that's okay, but I do also want you to just relax your fingers. You can rest down on a table, or you can do these with your elbow propped up on a table. And what you're going to do is you're going to, again, relax the fingers, and with the thumb straight up, you're going to try to bend and straighten just the tip of the thumb. And you want to do that one about 10 times. And you want to bend and straighten all the way through. So do make sure that you're going through that full range of motion and holding a couple of seconds at each range. What I often find is people just kind of try to bend and wiggle, but we're going down as much as you can go for a few seconds and then straighten all the way up as much as you can go for a few seconds. Okay, now what you want to do is you want to move the thumb a little bit around. So we're coming down a little bit more, and then we're going to bend and do the same thing and straighten and bend and straighten. And so this exercise is loosening the thumb up in a couple of different planes of motion of the thumb. And again, one more time, if you can, you want to bring that thumb down a little bit more. And again, you want to try to bend and straighten and bend and straighten. So we started way up here to try to get that mobility, and then we went kind of midway, and then we went a little bit farther down to try to get that motion going a little bit more. This can be challenging to do, and you might feel that as you go a little farther, there's not going to be much movement, and it might just be a tiny bit, but hey, a millimeter is something. So even if you're getting a little bit of a flicker of motion, that's something. Keep going with that. And you'd want to do about 10 repetitions a couple of times a day. Okay, so then the next exercise number 3, is to stretch out the thumb web space. So I often find that this can be a challenge for people, especially for those that have been in a cast or a splint, or maybe just kind of protecting the thumb. The thumb web space is not nice and open. So we really want to make sure we get some good thumb web space. That's so important when it comes to thumb mobility and trying to you know, hold on to a can or a bottle or grip even just a doorknob. We need to have this mobility open in the thumb web space. So to do that, you can do it a few different ways. You can either massage or work that using your other hand and your other thumb. And what you want to do is you want to just do some light massaging and some light pinching of that web space. And there's a nice tight thumb muscle called your adductor pollicis that gets very tight way down deep in there. And if you've been immobilized for a while, it's probably nice and tight. So we want to try to massage that and loosen up that thumb web space. Now, if you don't want to use your other thumb, what you can do is you can use like a chip clip and or a clothespin that might have a little too much pressure. You don't want something with a ton of pressure, but you want something that you can get right into that thumb web space. And now we're not right on the skin here. I'm not just on the skin. That's going to be uncomfortable. We're going a little bit deeper right to the meat of that thumb. And then what you want to do is you want to leave that on there for 10, 20 to 30 seconds. And then you can just relax that, whatever feels good for you. Now, sometimes what I have people do is you can incorporate that second exercise with this as well. And so if you felt like it was kind of difficult to move, maybe apply that little chip clip and do a few of those blocking exercises just to see if you notice if you get maybe a little more mobility. It might be that you do, and it might have been that little tight thumb adductor muscle that was kind of keeping you from getting some good mobility. So I would try that one a couple times a day as well. Okay, so tip number 4, this one is using an ACE wrap or tape or something to provide a low load, long stretch. So if you're trying all of these exercises and you've been trying to push and stretch and everything on that joint, on that thumb joint, and nothing seems to be working, then it could be that your joint has just been stiff for too long and it needs a longer stretch. So to do that, you would want to wrap it with an ACE wrap to help stretch it out for a long length of time. Now, if you don't have an ACE wrap, you could take your other hand and you could stretch your thumb across your palm. And then you would want to hold that there as far across as you can go for several minutes. But it's not always ideal for some people, so that's why I recommend an ACE wrap to wrap your thumb so that the ACE wrap can truly help stretch the thumb. Now, you're not wanting to stretch this to a lot of pain. You want to keep your pain around a 2 to 3 out of 10. That's very, very important because again, this is a low load, long stretch. Low load means it's not very aggressive of a stretch. It's just enough to where you can do it over a longer length of time. So what you want to do is you want to wrap around the wrist first to get yourself an anchor with this ACE wrap, so it's not like you're not fumbling with it. And I like to come on the back side and unroll it this way. That way I can come around and really stretch the thumb without the ACE wrap kind of slipping all over the place. So you want to flex the thumb as far as you can across your palm, making sure you're trying to bend at both joints, and then come over and stretch with that ACE wrap. Relaxing the fingers, coming down, and then coming back around on the back of the wrist. Anchor again. Come up and over again. Stretching as far as you can go. And you can come and wrap around as many times as you need to, really making sure that you're flexing and stretching. And then you can just tuck that piece of ACE wrap. And another suggestion, if you wanted to maybe kill two birds with one stone, you can actually keep your hand wrapped and then apply a little bit of heat to it at the same time for about a good 10 minutes. That might make that 10 minutes go a little faster for you. So after it's been about 10 minutes, when you're done, you would want to slowly remove the ace wrap, and you would want to slowly remove it and slowly move the thumb. You don't want to go too fast to where the thumb might kind of spring out, and the last thing you're going to want to do is try to straighten it all the way out. So do make sure that you do just a little wiggling of the thumb, wiggling of the fingers, and just kind of work that back out. It's not very comfortable going from flexion all the way out into extension. Okay, so then tip number 5 is my last tip, and this one is for strengthening. And so for this one, you're going to need some putty. So I really like using putty because there's so many different types of grip and pinching exercises that you can do with the putty. But for this particular exercise, this one's really good for the thumb. So what you're gonna do is take the putty and grab yourself some change. Maybe you have some loose change sitting around the house, or maybe you have some marbles or just some little knick-knack, something like that, that you can then put inside the putty. And then you're going to pick out each of these small little objects that you put in. So if you put in some pennies or some dimes or nickels, you're gonna put that in there, and then what you're doing is you're manipulating that putty and using that thumb to try to find the coins and pull them out. And you can put as many of these inside of here that you want. And I will put a link of where you can find the putty below. And then what you can do is once you take those out, then you can just work on just pinching and pulling that putty with your thumb, working on pulling and pinching down and working on various types of pinches with the putty. And I wouldn't do more than 3 to 5 minutes with the putty, because after you've done all 5 of those treatments for your thumb, then your thumb might need a little bit of a break. So everything together might take you about 15 to 20 minutes or so. But by now, after you've done all of those and ended with the putty, the thumb should feel nice and loose, nice and mobile. If you're feeling like you're having more pain, then I would suggest to back off on some of these, and that maybe you're just not quite ready for that whole sequence of treatments. Now, let me know in the comments below if this video helped you. Let me know which of these exercises that you're at right now, and if you were able to do all of these and what your thumb felt like afterwards. Did you feel like you had a little more flexibility? Did you feel like you had more strength and less stiffness in the thumb? If you found this video helpful, do please give it a like, give it a thumbs up actually, and also don't forget to hit that subscribe button below, and don't forget to check out these videos here that YouTube is suggesting for you. Thanks for watching.